How boss, welcome to another edition of Reading Aloud for adults. Today I wanted to share with you the Prescription for Nutritional Healing written by Phyllis Balk. And I wanted to share an excerpt in reference to types and warning signs of cancer. Now, knowing the warning signs and factors that increase the risk of developing different forms of cancer can save your life. The American Cancer Society estimates that of the 500,000 cancer deaths that occur in the United States, about 1/3 can be attributed to dietary factors, with another third being caused by cigarette smoking. Healthy lifestyle choices at any stage of life are a major step towards cancer prevention. The following are descriptions of some of the major types of cancers, including information about who is affected, what the symptoms are, and how these diseases can be detected and diagnosed, and what you can do to reduce your risk of contracting them. Now, the risk by 45, I'm sorry, I went the wrong way. All right, so let's start off with bladder cancer. Bladder cancer is the fourth most common cancer in males, eighth most common in females, and the fifth leading cause of cancer deaths in the United States. It is 4 times more common in men than women, twice as common in Caucasian as African Americans, and is usually diagnosed later in life. Causes and risk factors. The causes of bladder cancer is not known. Smoking is the number one factor associated with bladder cancer. Also linked to bladder cancer are exposures to certain chemicals such as benzodiazepines, aniline dyes, and naphthalenes, radiation exposure, hereditary, possibly extreme high consumption of saccharin, a history of schistosomiasis, which is a tropical disease, chronic urinary tract infections or inflammation, and working in dye, chemical, rubber, and leather industries. Signs and symptoms. Often symptoms don't appear in the early stages. The first warning sign is usually blood in the urine. Other symptoms can be pain and burning with urination, increased frequency of urination, and difficulty urinating. Detection and diagnosis. Bladder cancer can be detected by examining the bladder through a cystoscope, examining cells in the urine, or having intravenous phelography, IVP, a special kidney x-ray performed. Sometimes a large tumor can be detected through a rectal or vaginal exam. Researchers are studying a new screening test that detects telomerase, an enzyme that is produced by bladder tumors. Dietary and nutritional factors. Cruciferous vegetables such as broccoli, Brussels sprouts, cabbage, cauliflower, and kale have been credited with lowering the risk of bladder cancer due to their antioxidant and other cancer-fighting compounds. Eating the USDA recommended number of servings of fruits such as apples, berries, cherries, oranges, pears, and tomatoes can reduce the risk by 45%. Drinking a lot of liquids, especially pure water, helps to dilute carcinogens and increase urination, lessening the time any carcinogen in the bladder has to do the damage. Taking vitamin A, B, beta carotene, vitamin C, and multivitamins have been shown to reduce the risk of getting bladder cancer. Also, eating a diet that's rich in vitamin E that includes nuts and olive oils has been shown to help. So, I'm going to leave it at that. Bladder cancer, food for thought. Reading aloud for adults. Prescription for Nutritional Healing, 4th edition, Phyllis Balk. Thank you for your insight. Thank you for your information. Health Boss. Enjoy.